read, okay. See, there is little infection. You can see this. See, this is the heart shadow. Okay. These two sides are the lungs.
Okay.
It should be clear, black like this. But you can see this area. Chest infection is there. That's why so much congestion. So, what do you want me to do? Wait for one more day or admit?
Admit?
If cough is too much, that's the only option. Otherwise, to today evening nebulization, tomorrow morning, again once more you show me. Okay?
How many days?
Admit means what treatment?
IV injection, we have to give nebulization, all this more frequently. Okay?
Okay.
How many days?
But
One day.
now, that depends upon how baby is improving. Now, how is the baby after vomiting? Better?
Better, but Guru sound.
Sound is there. So, always sit and feed. Okay?
Sitting and feeding.
So,
Little
remove the dress, don't cover with this whatever, then again allergic.
Don't cover with them.
Still cure na ma'am.
That's why, if not improving, admit and give IV. Like we have to treat like that after admission.
After treating, cure.
Yeah, usually cures. You have to take care well, If that congestion is there, what do you want me to do? Tell me.
No.
Better is admit and give, because too much congestion. Breathing difficulty is there, means we have to admit and treat.
Small baby, na ma'am, how treatment will?
We have to put IV injection. We have to give more
There
frequently
injection.
nebulization. Yeah, hand through the cannula.
Nothing to.
See, we are treating all these kids.
Very small baby, 1 month of.
Very small also we have to treat. If you don't treat, that's more important. When it is very small, it is more important to more cautious.
After that, after treatment, it will go now.
It will go. It should go. That's what we are telling.
No, small baby, how needle and injection?
That we are putting. See, even small babies are admitting in special care BB unit also, na. There also we have to put injection only. Anyhow, you decide and tell me. Okay, because two other patients
how
are
many
waiting.
days treatment required?
It depends upon how baby is improving. Usually 3 days or 4 days, usually they
Yes,
improve.
you should be here only.
Yeah.
Mother?
Mother also has to be there because feeding has to be given. Na? Or if you want to wait
Very
one more
small.
day.
Very
Today-
small cold, ma'am. Very small cold.
See, dear, that's what I am telling. Very small means more risk. When it is small, they don't have the immunity. You haven't given vaccination. Okay? Then it is more risk. See, you
That
can
sound is
you can see that baby is.
If admit பண்ண ஒன்றும் பிரச்சனை இல்லைல்ல பேபி admit பண்ண
What person you are getting?
பேபிக்கு ஒன்றுமே பிரச்சனை இருக்காது.
See, we are admitting to treat the baby well, because if you give IV injections and nebulization more frequently, baby will recover fast. Okay, that's why.
No medicines, no ma'am. No medicines.
Medicines, that's what I given yesterday, the antibiotics, everything, but still baby, so what you feel compared to yesterday, better or worse?
Compared to yesterday, better. But
Then-
when cough coming, no, that time only difficult.
Okay. Then do one day. You do nebulization in the evening also today, and tomorrow morning come like this. I will see. If not improving, tomorrow definitely we will admit. Okay.
If we admit today, it is helpful.
not
Always
tomorrow,
IV injection and nebulization is more helpful than the.
It is nothing to affect baby for this treatment.
See, all medicines have its own side effect. Whatever I am giving orally also have side effect. Paracetamol also has side effects. All these have side effect. Do one thing. You 5 minutes discuss among you because these two patients they were waiting for long. Let me finish that. By that time you decide and tell me. Okay. 1 minute. You decide among yourself and tell. Okay.
Ticket number W13.
I am admitting all the kids, treating the pneumonia, I am sending. But I cannot predict like tomorrow it will be like any like whether child. It all depends upon tomorrow's response. We start the injection and see how the baby is responding or not. But now I cannot tell it will be completely okay. I cannot tell. I have to tell you the truth. Some kids improve in 3 days, some kids take 7 days to improve. I cannot predict that. If you want to try another hospital also, no problem for me. But seeing his distress, breathing difficulty, usually we suggest because baby is less than 2 months. It is a risk because when babies become more sick, oxygen level will drop. That's why we are all telling now. We'll admit. I will see tomorrow how the baby is. Okay. But never give milking lying down position.
No, ma'am, I'm not
Okay.
doing.
Can you enter that X-ray in the packs?
Not possible, madam.
Why?
Because the file number is different.
Yeah, now I changed the bill.
I will check that.
You changed the bill, no?
Bill change பண்ணாச்சு but ಅವರು கொடுக்கல மேம்.
I will check the bill.
They did change the bill, no?
Change பண்ணாச்சு.
They changed the bill here. The file number is 1447.
Wait. New bill or
The new bill.
okay, yes, sir.
1447
47
51
51
48
4
8.
or 8.
Yeah. Okay?
Just wait. I will madam, I will check. Yeah.
Okay. You have to do it somehow. Okay.
I will check everything.
Yeah.
Okay.
Yeah.
That is
Because if breathing difficulty and all improve at home, what you will do? Check the temperature also.
okay.
ఏముంది మా మనం జాగ్రత్తగా చూసుకోకుండా వచ్చింది సాత్విక ఉండేది లేదు వీటికి ఉండేది లేదు చెప్తున్నా తెల్లే పడుకొని వచ్చి లంగ్స్లోకి వెళ్ళి ప్రాబ్లం అవుతుంది
Ma'am, lying position, that's why came.
Now, I am telling now you should not give because aspiration risk is there. It may be your other kids have infection. Right? This is not only because of what is the
Other kids
don't
also.
blame her too
Ma'am,
much.
that
I
first
didn't
girl,
blame her,
ma'am.
no.
First girl, she has.
Normally babies cold cough it will come and go.
Mm.
Okay, like that only when baby is affecting that one, we have to avoid.
Ma'am,
Last 1 week itself, well, they having the cough and cold.
No, ma'am, she
They
had
together playing.
last month also she had
Yeah,
4 years.
always happen like that. School
Children's
boys-
means automatically it will come.
Yeah, what she can do?
I didn't blame anyone, ma'am. Just I am telling.
Yeah, I can understand your difficulty. She also don't want this thing to happen, so don't.
When
Yeah.
children are not good,
Yeah.
better maximum we have to avoid.
Yeah.
Small
Ma'am,
babies
that
can-
first girl,
Yeah,
ma'am, here only
they
she
will
born,
not
ma'am.
listen. That's the problem. The older kids, they are very attracted to the small babies.
Yes.
So what she will do? So it's okay, leave her. What we now there is no point in blaming. Now we have to
No,
treat.
I didn't.
Yeah, we have to treat the child. That's it. Okay. Anyhow,
Ma'am, that first girl also here only born, ma'am. She
yeah, I know.
now
I
she
know.
is 4 years old, ma'am.
Yeah. See,
She's
it
come
is not
now.
like that all the kids will be alike. And sometimes even for us, I may get infection, you may not get. See, I am sitting
Ma'am,
in.
she has cough, ma'am. Last month also.
Ah.
Night times she cough very.
Because in the school there is lot of infection here. That's what. Okay.
Ma'am, it will cure now, ma'am. Please tell me.
Yeah, we are trying for that, dear. Don't worry. Now we will start
Because
the
very
treatment.
small baby now, ma'am.
Yeah, check the weight once more, dear. Today you check the weight.
No, ma'am.
Only
Days
baby without
వారం
towel.
తడిస్తే బేబీని మాత్రం ఇక్కడ
Without
పడుతుంది
towel. Only baby.